Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D Wilson.
This is Pamela D. Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey, to let you know that you're not alone. You are in exactly the right place to share stories and learn about caregiving programs and resources to help you and your loved ones plan for what's ahead. Invite your parents, spouses, family, friends, colleagues, coworkers, and everybody you know to listen to the show. If you have a question or an idea for a future program, share your idea with me by commenting on my social media posts on Facebook, Instagram, Twitter, YouTube, and LinkedIn. You can also go to my website, PamelaDWilson.com, click on the Contact Me button, and complete the Caregiver survey. On this episode, we're here to discuss the relationship between pain and caregiver stress. Caregivers take responsibility for caring for sick, aging parents, spouses, children, and other family members. Occasional sickness or ongoing health problems can result in pain that doesn't go away. You may have heard the word chronic related to chronic health or disease. Chronic is medical speak healthcare terminology used by doctors, nurses, and other people, and it means something that lasts more than 3 months. Chronic illnesses often result in chronic pain. So if you're a caregiver of a person experiencing chronic pain, you may be on the receiving end of their anger, verbal outbursts, agitation, or a loved one who is constantly short-tempered. If so, this person may be experiencing chronic pain and not realize that pain is the cause of their behaviors. Research confirms the link between chronic illness, chronic pain, and anger. During this podcast, we'll discuss pain and related causes of anger, how anger affects caregiving relationships, and how to recognize the effects of pain on the body and interpersonal relationships. Chronic illness, pain, and anger link to other aspects of life that may not be obvious until we give this a little more thought. Chronic disease can result in pain that translates to anger. If you are a caregiver, ask the person you care for about their experience of pain. Can mom or dad give you a rating of 1 to 10, 10 being unbearable, I just can't stand it? If an aging parent is in pain, has anything been done to investigate the source or the cause of the pain? Have you talked to the doctor about this? If yes, what was or is the treatment plan? Initial suggestions to alleviate pain can include physical therapy, medications, and sometimes interventions like injections. These interventions vary in the effort that you have to put forth, the potential side effects, and obviously the time required. For example, taking Tylenol for pain, anybody can do that. On the other hand, a pain medication that requires a doctor's prescription, if it's a narcotic, can mean the requirement for ongoing doctor visits. Stronger pain medication can cause drowsiness, constipation, nausea, an upset stomach, cloudy thinking, kidney damage, a weakened immune system, depression, and falls in the elderly. Opiates, which are strong pain medications, they can be highly addictive if you take them for extended periods of time. So for anyone, especially some older people who don't want to take medications or who experience side effects from pain, taking medications may not be a solution. What other options exist then to stop pain from ruining caregiving relationships? Depending on the source of the pain, physical therapy can be an initial solution to investigate. Physical weakness combined with activity can result in pain. So let's say that you go outside and you mow the lawn or you shovel snow, and the next day your back or your shoulders or your arms are in so much pain they just ache. It would probably be pretty safe to say that you might have overused these muscles, or the muscles were weak, if mowing or shoveling are not regular activities. The pain in this case results from weak muscles, from just not doing anything. A study by Tanaka, and I'll place a link in the show transcript, describes the relationship between knee osteoarthritis that can limit physical activity. All of this increases muscle weakness, and then there's a link between what I call the brain-pain connection. If you've had any injuries, you may be able to relate to the examples that I'm about to share. Plus, if your aging parents have arthritis or any type of pain, and they limit their activity, this research offers insights into why limiting activity, why not doing as much as you used to do, worsens physical disabilities and increases pain. So let's begin with a definition and a description of another healthcare medical term. It's called pain catastrophizing. Pain catastrophizing means that a person has a tendency or a habit to focus on pain and feel helpless about any actions that can be done to reduce the pain. And so as a result of this, what caregivers see is disruptive behaviors, attention-seeking behaviors, demanding behaviors, verbal abuse. In these situations, it's true, pain can ruin caregiving relationships. Focusing on pain and feeling helpless to do anything can become a habit or a pattern in how a person thinks about pain. Another emotion, fear, also contributes to experiences or thoughts about pain. Let's look at a simple example. You, your children, or an aging parent need a vaccine. Fear of that needle in your arm that delivers the vaccine can be catastrophized and cause a lot of worries. It's easy to imagine that the stick of a needle will cause short-term pain resulting from the needle. Temporary arm soreness may also be the result, but some people get so worked up emotionally when they're scheduled to receive an injection or see the dentist for a filling or some other procedure or go to the doctor. And then usually when that procedure is done and over, the thought may be, well, that wasn't as bad as I thought it would be. There's also the idea of a nurse, a doctor, or a dentist preparing a patient, saying, now, this is going to hurt a little bit, so be prepared, so that the patient isn't surprised. Managing beliefs about pain or perceptions about how painful something will be is really important to managing thoughts and emotions around pain. People might avoid activities they perceive to be painful when really, if they would do them, the pain isn't that great. So here's an example, dentist again, right? For example, I know I need a filling, but the injection is painful, so I don't want to go to the dentist. Or maybe I don't have the money to pay for the dentist. So this is just an excuse that I'm using not to deal with the pain instead of investigating other options to receive dental care. I have knee pain, another example. The physical therapist shows me exercises, but I do the exercises, they hurt and they cause more pain, so I'm not going to do them. These type of thinking patterns can result in avoiding activities that in the long term will reduce pain. Focusing on feeling pain can lead to avoiding all these short-term actions that, yes, they may cause pain, but in the long run, the pain's going to be less. So if you have a cavity and you don't get it treated, you could lose the tooth or several teeth next to that tooth can have cavities, or you can have infected gums. Then you have a bigger problem than just one tooth. You may have like one side of your mouth that's a problem. If elderly parents have knee pain and they refuse to participate in therapy, eventually they may be unable to stand or walk. Not being able to stand or walk, if you're a caregiver, you know this, it has far-reaching implications that a parent may not think of today. So let's look at an arthritic knee. Any type of pain there can lead to a parent saying, no, I'm not going to exercise. And then the muscles in the legs and around the knee get weak, and there's more pain. And there's eventually physical disability, which means it's difficult to stand and walk. And that requires more help from a caregiver. Eventually, elderly parents may be so weak that they can't leave home to go to a doctor appointment or to go grocery shopping. And then after that, maybe a wheelchair is the only option to get around. So when anybody says that they are in pain or experiencing hurt, as a caregiver, you want to investigate the cause, research potential solutions, and then have an honest conversation about a plan. These functional or physical changes in the human body's ability can really fast forward the effects of aging. In very simple terms, a body that does not move or walk will eventually lose muscle strength and become physically weakened and possibly become disabled and eventually have a great deal of trouble moving or walking. People with dementia are more susceptible to losing the ability to perform these physical activities if there's any break in their routine. People with memory loss forget how to walk and perform daily activities. Athletes, on the other hand, and people who exercise regularly, have what is called muscle memory. Muscle memory is the ability of muscles to take a break from exercise, and then when exercise begins again, it's the ability to regain this lost strength in a shorter period of time. So the more that you exercise, the more muscle memory you gain. This is why active and healthy people recover way faster from illnesses than people who may already be sick, not active, or have a weakened immune system. When you strengthen weak muscles in the body that may be a source of pain, eventually that pain lessens or goes away altogether, and then you have strong muscles. The critical consideration here is to find a treatment recommendation and stick with it. Be consistent. So along with this idea of pain, catastrophizing is that relationship between emotional and physical pain. Now, the body's neurological system processes emotional and physical pain differently between the right side of our brain and the left side of our brain. And truly, sometimes the brain doesn't know the difference. So, for example, if you think of the pain of being rejected by somebody that you love or not getting the job of your dreams, this emotional pain can be felt as strongly as physical pain. And there's another term called psychogenic pain. Now, this relates to physical pain that is caused by emotional stress, and it's real. And we'll talk about this briefly, but if you're interested in learning more, search for the Caring Generation episode 68. It's called Caring for an Elderly Parent You Don't Like. On that episode, I interview John Leach about the psychology of human survival, where he describes in detail psychogenic reactions to stressful situations. Psychogenic or emotional pain can result from pain, stress, or anxiety. The mind can create all of these physical symptoms in the body, and you know this, right? Back pain, shoulder pain, neck pain. If you're emotionally distraught and you have a headache, you probably have pain somewhere else. Fear of survival or worries about the ability to manage day to day that many caregivers experience can result in a lot of physical aches and pains. Pain is very complicated. Pain can also cause anger. That's disruptive to caregiving relationships. Emotions and thoughts also contribute to this. Let's take a short break, and then we'll return to discuss the relationship between pain and caregiver stress. And we'll take this conversation a little further to consider aspects that we may not consider if we don't know a lot about pain. Caregiving doesn't have to be a do-it-yourself job, although many people try. My website, PamelaDWilson.com, offers help, support, and education for caregivers and aging adults by way of online courses, articles, and more. Plus, this podcast, The Caring Generation, with over 150 episodes, answers questions caregivers ask. It's available worldwide on my website and your favorite podcast and music apps like Apple, Spotify, Spreaker, and others. This is Pamela D Wilson, caregiving expert and advocate on The Caring Generation. Stay with me. I'll be right back. This is Pamela D. Wilson, caregiver expert, advocate, and author on The Caring Generation. Check out my website, PamelaDWilson.com, where you will find my online caregiver course, my book, The Caregiving Trap, caregiver blog, this podcast, articles in my caregiver library. There's something for everyone at PamelaDWilson.com. So where do we go from here to advance the conversation about the relationship between pain and caregiver stress? Let's look at the effect of emotional expressions on pain and caregivers. A loved one experiencing pain can make caregivers feel powerless to do anything, hopeless that there may be a solution, and pretty consistently anxious and uncomfortable. Expressions of pain can strain caregiver relationships when verbal outbursts, hitting, or throwing items become routine. Physical or verbal expressions of pain can also, though, help a person release their anger, but the question is at what cost? Unfortunately, many caregivers are on the receiving end of these outbursts, and they're afraid to say anything for fear of making the reaction worse. It's no surprise people in pain can be verbally abusive. Their voice and their words become their weapons to attack other people. So when this happens, the caregiver, instead of saying anything, says nothing and walks away because they don't know what to do and they don't want to be on the receiving end of more abuse. But here's the catch. This non-response can be perceived as agreement that this expression of anger is okay, when really it's the opposite. The caregiver isn't saying anything because of feeling threatened and powerless. This dynamic of an elderly parent or spouse expressing pain in front of a caregiver then becomes damaging to the relationship. The path forward here is to confront the pain, not the person. You want to identify the source of the pain and figure out some solutions and then create an action plan. Now, the problem is this can be a long or frustrating process if the pain's been going on for a while and if healthcare providers struggle to figure out the cause of the pain, especially if suggested treatments have been tried and they don't work, and now you're battling with insurance companies and it's just feels like more of a hassle, right? But here's the reality. You may have to go through several doctors until you find somebody who's willing to listen and truly take an interest and help. For caregivers, taking time off work to attend medical and other appointments can be challenging. So there's a lot of hurdles to overcome to solve pain. Let's look at pain and its effect on interpersonal relationships. So this person in pain may be so confused thinking about themselves and their pain. And if you're the caregiver, you have to be brave enough to open up a conversation. Now, if you're a healthy caregiver, this may be hard because it's hard for you to understand or empathize with the effects of pain on the body or the mind because you don't have any personal experience with that. So what you can do is do some research. Learning about pain can help you become more empathetic. Even still, though, being empathetic can't take the place of removing yourself from the position of feeling threatened. So how do you do that? It's okay to say something like, Mom, Dad, husband, wife, I can't imagine the pain you feel from X. What I notice is that the pain makes you angry because you yell at me, throw things, accuse me of not being a caregiver, whatever it is that you experience, right? Mom or Dad, these behaviors make me feel really uncomfortable, and I know that we both have feelings about this. I also realize that you may not see my feelings as equally important to yours because you're all consumed by this pain, but I do have feelings. And when your pain and the way you act make me feel this way, I really don't want to be around to care for you. Now, you got to be ready for an explosion because the person that you care for who is in pain is likely going to feel attacked, so their first inclination is going to be to strike back. They may say that as a caregiver, you're inconsiderate, may accuse you of a long list of other things, insult you. My recommendation is to hold your reaction and consider that they're reacting out of pain and they can't control their emotions. People who respond emotionally in any situation doesn't have to be caregiving. Most of the time, they've not learned to cope with pain or problems or constructive criticism. And this includes caregivers. Learning how to respond appropriately to stress is a skill that anybody can learn and practice to preserve your relationships with other people, whether it's at home, in the workplace, or in social settings. Likewise, dealing with conflict, which most people don't like to do, is a learned skill. If you're in any relationship, conflict and disagreements of opinion, they happen all the time. But if we can look at conflict as an opportunity for growth, understanding, and improving communication skills, then it's possible to reframe the anxiety that we experience about talking to a loved one in pain. And we can do this in a more positive light. Because to identify the relationship between pain and caregiver stress, we have to look at the effects of anger and address the concern directly. How we respond in any high conflict situation can either escalate and raise emotions or have a calming effect. Separating the person from the problem can help make this discussion and the way that you think about this more manageable. Look at the pain and anger as contributors to the emotions of the person you care for. The goal is to depersonalize all these issues, the pain, so that it can be discussed without emotion. This requires removing blame and taking ownership of feelings and actions, which can be difficult for the person in pain. But it also eliminates the ability to make excuses for why improving pain can't happen. When you talk about pain, it can be challenging, and we know pain can ruin caregiving relationships, but being right or wrong here's not the goal. The future of your relationship is what is important if it's important to you. If so, then working through these issues is necessary. Compromise, collaboration, and more patience than you feel you have is probably necessary. Being flexible to move past what each person wants to find some type of common interest or middle ground, like mutual respect, for example, and the ability to feel comfortable talking about difficult situations can be a great starting point. So let's talk about the relationship between chronic pain and anger even a few steps further. Another aspect that's gained more attention due to the isolation that happened during COVID is loneliness. So according to research by Powell at the University of Michigan, loneliness also predicts pain, fatigue, and depression among older adults. So when you think about the mind-body connection, feelings of loneliness can result in stress. And along these lines, family caregivers can have this experience too. You devote your lives to care for a spouse or an aging parent, so you trade parts of your life. And because of that, you don't see your friends as often, and you experience isolation and loneliness. So what happens down the road is caregivers may be diagnosed themselves with multiple chronic illnesses. And because of this, you're in pain. You feel anger, similar to the people that you care for. So until we look at this big picture of health and how health problems worsen and the effects of this on the individual and the caregiver, we may be continually faced by problems and issues that we just don't know how to solve. We're in this circling the drain of like, oh, what do we do? It's getting worse. We don't know what to do. So we have to look at and think about the links between chronic disease and pain and loneliness. Thinking about the link between chronic disease and pain and loneliness is important when it comes to caregivers who feel like they have to take on a lot of responsibility, which really isn't good for the caregiver or the care receiver. Any relationship, unless there's efforts to be outer focused, which means, be in social situations, have friends, be active in hobbies, things like that. Unless you make an effort to do that, the caregiver and the care receiver become isolated because you become the only people that you see for extended periods of time. It's kind of like, when you were hanging out with your friends. Out of the blue, you meet a boy or a girl and you want to spend time with them. But unless you commit and plan to see your friends, those friendships go by the wayside because all your focus is on this boy or girl or man or woman that you're just in love with and you want to be with them all the time. And your friends, well, you kind of just drop them. So it's true that our lives and where we spend our time reflect our priorities. Question to ask is, how do you spend most of your time and with whom? And when you add anger and conflict into caregiving situations, then you've got emotions that translate into situations that could be co-occurring abuse. We talked earlier in the program about pain catastrophizing. People who need care can become very critical of themselves, blaming themselves for poor health or their caregivers for not doing enough. Then you've got feeling lonely that can lead to depression, fatigue, and pain. So how do you find the motivation in this mess to become more active or to exercise, which are solutions to reduce pain? This motivation really has to come from deep within. While we can try to motivate anybody to take action, we can't force anybody to do anything. And even though caregivers who try to do it all can benefit from motivation, it's kind of the same issue. Nobody can force a caregiver to seek help, resources, or support. So all of these components form the perfect storm: chronic pain, anger, loneliness, isolation, a lack of motivation, depression. And what you have is this endless spiral of poor health. A relationship with a spouse or an aging parent who needs care can really become like quicksand that just pulls the caregiver down with this person. This relationship between pain and caregiver stress has a long-term effect on health and well-being of caregivers. Knowing this, having this knowledge, makes it really important for caregivers to take the initiative to speak up, to discuss health and expressions of anger. If you're a caregiver or a care receiver who's been in this situation for a long time, you may say, well, I'm just used to it. It's okay. And you may be hesitant to change the situation. But I'll tell you, your health depends on it. Your well-being depends on it. Chronic health and pain are serious concerns connected to so many aspects of life. People who work through pain research alternative means of treatment that may include exercise, meditation, listening to music, cold packs, hot packs, pain patches, creams, stretching, TENS units, cognitive therapy, massage. There's a lot to look at. Being attentive to the body-mind connection is essential for well-being. And as we talked about, it really is possible to work oneself up into this frenzy of worry and catastrophize. And then you're in more pain and you're emotionally distraught and you got headaches and stomach aches and life just is the pits. How many of you do this? How many of you don't get a good night's sleep every night because you're stressing about something or you're anxious? Pain can interfere with your sleep, which is vital to managing depression, anger, and stress. Think of how you feel when you get a really good night's sleep versus a night when you can't fall asleep or you wake up and you can't get back to sleep again. All of the sleep deprivation, caregivers, you know this, leads to you feeling more frustrated, irritable, sad, or angry. Sleep is really this time for the body and the mind to rest because deep sleep helps our brains process through our emotions and our memories and thoughts and problems. If we don't get a good night's sleep, we might be more forgetful the next day. We may just find that we're exhausted and we're worried that our to-do list isn't getting shorter or we're less effective in what we're trying to do. So it's important to find time to yourself, to sleep, or doing some type of enjoyable activity. Your brain and your body need time to recharge. And so if you do that and something happens, you may actually respond more calmly instead of blowing up or becoming irritated when something goes wrong. The relationship between chronic pain and anger is way more than meets the eye. Health is affected by so many aspects of life that we may not think are related. Here, you love your job, you hate your job, you're stressed about paying your bills, you don't have a reliable car to get to work, you have to take a parent to a doctor. All of these life events do affect your emotions and your mind and your body. Worry and anxiety can become this weight that prevents caregivers from problem solving and taking action to solve problems because you're exhausted and you can't find the motivation to do anything. And so what happens is caregivers become stuck in a negative pattern, repetitive, unproductive situations. You don't know how to make any changes. And so you just become stuck, and you become stuck with someone else who is angry and in pain. So take some time, listen to this podcast again. Think about the relationship between pain and isolation and a lack of sleep and caregiver stress and the relationship that you have with your loved one. And use this podcast to open up conversations, to think about ways to approach identifying pain and managing relationships that right now may be pretty lopsided. You're scared to death to have this conversation. But until you do, I promise you nothing is going to change. I thank you all for continuing to post questions for this podcast and the videos that I share on my YouTube channel. If you're looking for answers to caregiving, aging, and health questions, visit my website, PamelaDWilson.com. There's an extensive course on there, zero charge, takes you through the A to Z of caring for elderly parents or yourself. You can also join my online Facebook Caregiver group. It's called the Caregiving Trap. This is Pamela D. Wilson, caregiving expert on the caring generation. Thanks for being here. I look forward to being with you again soon. Have a fabulous day and enjoy every day until we are here together again.
Tune in each week for The Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.